Is Anne-Marie Hughes. I am a 10-year survivor of pancreatic cancer. And with me today, I have Dr. Sanjay Reddy from Fox Chase Cancer Center. Hi, doctor.
Hi, how are you? Thanks for having me.
Wanted to get from you what you are grateful for this Thanksgiving month.
Grateful for a lot of things, family, support, and professionally, I'm grateful for being a part of an institution that really strives not only for clinical excellence, but we also work quite hard in the stuff behind the scenes, right? The science behind pancreatic cancer. We've been able to assemble a very unique ensemble of clinicians and scientists that all focus on pancreatic cancer. These unique collaborative efforts that we've been able to implement really scientific thoughts from the lab and push it into clinical medicine. And I really think it's through these groundbreaking efforts that we can advance treatment in this disease.
If we could back up a little bit and you could tell the audience what it is that you're doing at Fox Chase in the fight against pancreatic cancer.
I'm one of the associate professors in the Department of Surgery here at the center. I serve as the associate program director for our complex general surgical oncology fellowship. I'm also the co-director of the Marvin and Conchetta Greenberg Pancreatic Cancer Institute. And this is a collaboration between surgeons and medical and radiation oncologists, and also very importantly, the basic scientists. I think that is where pancreatic cancer treatment has changed over the past 10 years, is really focusing on the team behind the mission. And I think that is something that we do very uniquely here at Fox Chase.
Maybe if I could also understand how it is you came to focus your efforts on pancreatic cancer.
So I chose this path really in treating patients with pancreatic cancer for several reasons. My dad's a surgeon, and he spent his career in New York City. And in the beginning of his career, he focused on pancreatic cancer. So I saw early on kind of the struggles, how bad the disease was, right? There's a lot of other cancers out there, so much research and talk, but back when I was, in the 80s, there was not a lot of talk about it. So when I decided to pursue a career in surgery, the transition into my practice seemed seamless. Learning from my dad was a tremendous help for me. And it was really a motivating push, right? For me to continue the efforts that, he started early on in his career. While breakthroughs really come in small increments, I think where things are important to note is that they still happen. And this really recognizes the fact that we need more work to be done. Patients, in my opinion, afflicted with this disease deserve the opportunity to benefit from medical breakthroughs, just like those with other cancers.
What are the early symptoms that people really should not ignore?
Pancreatic cancer is just termed the silent disease, and that's not far off. And I think when a patient comes with a diagnosis of pancreatic cancer, the tough part is that symptoms can be variable, right? So these can range from simple things like nausea, vomiting, vague abdominal pains, to more sinister things like jaundice when somebody's skin or eyes turn yellow, a weight loss, or just this general feeling of malaise. I think one of the most common presenting symptoms that you'll see is also people will note dark urine, right? Chalky stools. Those things should tip you off that something is just not right. And I think this is the time point where action has to happen, right? And the simplest thing to do, go to your primary care, let them start the workup. Just simple blood tests will not diagnose pancreatic cancer, but could potentially cue you in that something is wrong. A lot of the times it'll be nothing, right? But then at least you know.
Doctor, what are those blood tests that stick out to you that indicate potential pancreatic cancer or insufficiency?
Simple things just like liver function tests, right? So if you have an elevated bilirubin, for example, there's a lot of things that can cause that. But it could be a stone that's blocked in your bile duct. It could be sludge in your bile duct, or it could be a mass in the head of your pancreas. So that's a trigger, right? You have that value done that prompts workup. Usually you'll get an ultrasound or a CAT scan, then something will get identified. And if they do see something, then the next avenue you get is an endoscopy and a biopsy. We confirm a diagnosis, and you come and see me. So it all starts just from simple things for a patient to be proactive with their health.
Maybe you could talk to us a little bit about when surgery is appropriate.
Listen, ultimately, a patient's knee-jerk reaction is, I just want it out, right? And sometimes we just can't get it out. And what we've done is incorporating chemotherapy and radiation before surgery to try to shrink it, right? We're looking for ways to trick the disease, to shrink the disease so that we can go in there and try to remove it. It's not about removing it oftentimes too. We want to try to take it out with margins that are clear and negative, right? But the big hallmark of pancreatic cancer is that this is a systemic disease at the onset. I always tell patients that, there's these weeds and seeds that I can't see. I can pull out the plant, but what do you do about those weeds, right? So this is where combination multimodality therapy is so important, to kill the things you can't see, so that when the time is right, it gives me the opportunity to kind of clean it up. Even in those patients where surgery is not possible, treatments with chemotherapy have gotten so much better that people can live and have good quality of life, even if they can't get to an operation. We've also made a lot of advancements in robotics. I do a lot of the tail and body lesions robotically now. So it minimizes incisions and recovery. And I think that field is emerging more and more. So that's something also that's exciting and on the horizon.
What did you see from the whole effort behind COVID, where that could be applied towards pancreatic cancer research?
First part of it is, COVID provided this very unique perspective in treating patients, not only with pancreatic cancer, but every other cancer that we see, right? We essentially adapted. We learned best practices, how to keep patients safe during their pancreatic cancer treatment journey. The true challenge is that during treatment, patients are the most vulnerable they're going to be to infections, right? But simple things like masking, social distancing, and then bam, vaccinations truly allowed patients to go through and complete their treatment as safely as possible. The second thing is, wow, if we can put our minds together, we could do anything, right? We, in a matter of a year, figured out how to get a vaccination, a booster shot, and dramatically changed a disease. COVID is almost like a disease, right? That affected everybody across the entire globe. So we have the brain power to do something and make a change. It's just utilizing those resources. But this is where groundbreaking efforts kind of in the lab really kind of push forward. I think that it really showed us that anything is possible with time, patience, collaboration, and, just a little bit of luck.
I'm wondering if you have any final thoughts you'd like to convey to our audience.
I think so. There's so many promising developments in the treatment of people that are afflicted with this disease. And again, I want to just really emphasize here at Fox Chase, we've really embraced this idea of multimodality therapy, specifically, again, utilizing chemotherapy, radiation, and then ultimately surgery. I think this offers a unique kind of plan of attack, right? It's all about how you sneak in and sneak out, right? To treat this disease. Chemotherapy regimens get better. As radiation techniques continue to evolve, patient outcomes will follow suit. The big obstacle in treating those with pancreatic cancer is figuring out a way to tackle this shield, or this, like what we call this fibrous stroma over the gland. And one of our basic scientists, Eddie Kuckerman, who's like a thought leader in this field, really has looked at ways to modulate the stroma, right? So we're not looking to destroy it. What we're looking to do is normalize it, right? So that we can allow for potentially better drug delivery to treat this disease. And again, everything started in the lab and through our, Marvin and Conchetta Greenberg Pancreatic Cancer Institute, we've really been able to incorporate a lot of the things we're doing in the lab into clinical trials. And currently we have a couple very, very promising clinical trials looking at different ways to modulate the stroma for pancreatic cancer, and also different radiation techniques to do the same. So our hope is that with our continued collaborative efforts, we'll really pave the way for some future breakthroughs. And, just wage hope, right? I think that's the most important thing to say, is that you have to have hope. You have to have good social support. You have to have a good team behind you. And I think if you have all those things in place, it'll set you up for success.